The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
Very warm good evening to our viewers and welcome to yet another episode of Kim's Health Dr.LIVE. Myself, your host, Ganga Jain. Today we are delighted to have with us Dr. Pradeep Divakaran. He works as an ENT specialist in Kim's Health Medical Center, Morocco. Today's topic of discussion would be snoring in children. Thank you for joining us on the show and welcome to the show. Before we come to the topic, could you please tell me about snoring in general?
Snoring is a very common terminology and everyone experiences snoring in their life. By definition, snoring is a harsh sound produced when the air flows through the throat and the soft tissue vibrates, and that audible sound is called snoring. And the thing is, people snore now and then. That is very common, but those who are snoring on a regular basis or those who are snoring on daily basis has to be evaluated for an underlying serious pathology.
So why most of the people don't consider snoring as a medical condition?
Even though snoring is a very common condition, everyone experiences it, but most of them, they are thinking like this is a part of a deep sleep. So even though they experience on a daily basis, they will not come to a doctor because they are thinking like this is a normal thing with a deep sleep.
So today we are discussing about snoring in children. So what is the relevance of snoring in adults and compared to the children?
The snoring is a vast subject to be discussed in a single session. The snoring in children, there are a lot of ENT causes that makes for the snoring, and most of the conditions can be treated so that we can prevent the further complications in kids. That's why the importance of snoring in kids, what I selected to discuss today.
Okay, so it can be found at an earlier stage, then it can be treated, right? Yes. Okay, so what is the common cause of snoring in children?
There are a lot of conditions then present as snoring. The most common thing which I discuss as an ENT surgeon, the first thing is the tonsil enlargement. Everyone knows about tonsils. Tonsils are the lymph tissues located in our throat. It is getting enlarged either physiologically or pathologically, causing an airway compromise and snoring. Second one is adenoid. Adenoids are nothing but similar to tonsils. They are the lymph tissues. They are a part of immune system. Once they get enlarged, it causes nasal block. So once the nose is getting blocked, the child is obviously open his or her mouth to breathe, that is causing snoring. And other one is a nasal allergy. Nasal allergy very commonly, especially in the Middle East, we see a lot of nasal allergies. That is another reasons to get a mouth breathing and snoring. There are conditions of the nose, anatomical variations like a deviated nasal septum or inferior truncated hypertrophy. These are another conditions that can present as snoring in kids. And other one, you have seen the kids with Down syndrome and craniofacial abnormalities, and these are another reasons to their continuously goes for snoring.
Okay, so there are several reasons.
Yeah, and other one which I just forgot to mention is obesity. Obesity obviously not only in kids, even in adults, that is the main reason to get snoring.
So among the case you mentioned about the ENT, so what are the ENT causes?
ENT causes mainly the tonsil enlargement, adenoid hypertrophy, the deviation of the nasal septum, turbinate hypertrophy secondary to nasal allergy itself, and as we usually come across the common cold, the flu, these kind of things. These are the ENT causes that responds for snoring.
Okay, so when should we be concerned about snoring?
Yeah, we come across with the snoring in kids in several occasions, but no need to get worried. But we need to consider, or we need to think about to consult a doctor when you notice an abnormal pattern of sleep. If you notice the child is getting up from the sleep without like a choking episodes, or you feel like the child is not performing well in the school, maybe due to an underlying hearing problem, or child is more sleepy, lethargic, or you feel like the facial expression, the facial figure of the child is getting some changes. So these are the conditions you should observe, and you should think about taking your child to a doctor to get checked.
Yeah, so before we check, we should observe the symptoms.
Yeah, right.
So what are the symptoms of enlarged adenoids?
As I said, adenoids are commonly called in Arabic lahamia. These are similar like tonsils. The location is deep behind the nose. So when it gets enlarged, the nose gets blocked. So first and common symptom is the nasal obstruction, and because the nose is obstructed in the back side, nasal discharge is another presenting symptoms. And adenoid is located deep inside the nose. There is a anatomical relation with the tube that going to the middle ear. So recurrent middle ear infection, child going to the doctor with a recurrent ear pain, and if it's keep on coming it, there is a condition called secretory otitis media, that is commonly called as the water in the middle ear. Okay, so these are the common complaints, common symptoms that is observed in adenoid hypertrophy or enlargement.
So how will you diagnose adenoid hypertrophy?
Detailed history to the parents if you are suspecting an adenoid hypertrophy, like how the child is sleeping, how is the pattern, whether is child waking up during sleeping, is there any nasal obstruction, is there a recurrent cough, is there any dry mouth, excessive daytime sleepiness, how he or she is performing the school, and a detailed ENT examination. And very easily in a cooperative child we can do an OPD setup, we can do a flexible nasal endoscopy. That is the best thing to be diagnosed. Most of the children, they cannot tolerate endoscopy, so an X-ray is more than enough to diagnose adenoid hypertrophy.
Okay, so what is the treatment of adenoid enlargement?
Adenoids are get enlarged and depends upon symptoms. If the symptoms are not that severe enough, we can treat it medically, like treatment of allergy like antihistamine, nasal corticosteroids, if there is infection, some antibiotics. And if it's not responding and child is getting more and more complications and getting middle ear infections, secretory otitis media, in the situations we need to intervene surgically. It's called adenoidectomy, surgery on the removal of the adenoids. So we can manage medically as well as surgically. So we will try first with the medications. If not responding, or in a child in a condition it already end up in a complicated stage, just go ahead with the surgery.
Okay, so what will be the complications if not treated earlier on time?
If you cannot diagnose, or if you couldn't see a doctor on time, as I said earlier, the middle ear infections is very common. So the middle ear infections is keep on coming. the middle ear is filled with water. It's called glue ear or secretory otosum media. So it's getting unnoticed, and child because of the struggling to get sleep in the night, the child is sleepy in the class and she or he cannot listen, a poor school performance. And if it's again neglected because of the continuous mouth breathing, what happened, there is something called adenoid facies. Adenoid facies is nothing but the facial skeleton is deformed. In the case, the child looks like the nose is because very pinched up, mouth is always open, crowded teeth, high arched palate, lethargic look. These are a long-term complication of a mouth breathing due to adenoid hypertrophy. The facial skeleton literally deforms.
So as you mentioned, tonsils are another common cause. So does it need to be removed?
Obviously, if tonsil is only reason for a snoring, because abnormally enlarged tonsils, there are grading system of tonsils. The largest one is grade 3 and grade 4. And if you are sure there is no other underlying problem except the tonsils that is causing the snoring, you have to remove it. It's called tonsillectomy. It's usually done under general anesthesia.
Okay, so it's like in complicated cases.
Especially the tonsil is the response for snoring. It's a huge abnormally enlarged tonsil that is the response snoring, then has to be removed.
So how many days the child need to be hospitalized for these surgeries, and what anesthesia is preferred?
In children's adenoid and tonsil surgeries, definitely we are doing under general anesthesia. It's 24 hours is a maximum hospital stay, and sometimes we can send the child on the same day evening or the maximum next day.
Okay, so nasal causes snoring. Can it be corrected in this age group?
Obviously, the child is snoring because of the obstruction of the nose. When you are examining and you see there is a deviated septum or a terminate hypertrophy, most of the time you will try to correct it with medications to some extent. Why? Because these children are still growing. To complete their facial skeletal structures, it reaches around 17 to 18. So preferably you should avoid surgeries on the nose in kids especially. So if it's definitely is needed, there are surgeries are called conservative surgery, because even if you do surgery it will get recurs. So if in really needed we can do it, but preferably get avoid actually.
What are the other common measures to prevent snoring?
As far as I discussed the ENT causes in general and how to treat it and to prevent complication, there are a lot of other stuff to be considered as a snoring, is a part of a snoring. especially the allergy. Allergy is the main reason, most commonly because of the, especially in GCC, because of most of them indoor AC, outdoor the dust. Some parents, they do smoke in the house, pets inside the home, and these are things to be considered. And the use of the incense and the perfumes. Some people, they use called in Arabic called buhur, you know, the smell megia. These are the things to be you should look for. Is there any reason for the nasal allergy? That has to be controlled. And obviously the obesity, especially the kids growing in the Middle East, they are obese. So the food has to be controlled and should maintain a proper weight. That is also to get controlled.
Yeah, so the lifestyle
modifications is very important.
Okay. So what is your advice to the parents if they notice their kids are mouth breathing or snoring?
So the parents definitely notices the child knows, especially in the time of upper respiratory infection, flu or common cold. That is quite common. But if they notice like abnormal mouth breathing, or the child has an abnormal waking up pattern during sleeping, if they feel so, don't wait, get checked with the ENT doctor. There are a lot of underlying problems to get diagnosed. If they corrected on proper time, we can prevent the complications.
So doctor, which branch are you working in?
I'm working with KIMS Health Medical Center, Muharraq branch. I'm an ENT specialist, and my working time from 9 o'clock till 1 p.m. evening from 5 p.m. to 9 p.m. all the days except Fridays.
So before we wind up, is there any final advice for our viewers?
Snoring in children is very important because there are a lot of causes that are contributing snoring in children, but as there are a lot of ENT conditions that we can diagnose it on time. If you come to an ENT clinic and get diagnosed, and if you can treat it on time, whether it's medically or surgically, you can prevent a lot of complications. So the timely diagnosis and treatment is a mainstay of treating the snoring. So if you notice your kid is snoring, please don't get hesitated, get a medical checkup.
Thank you for answering all of our queries, and stay tuned. We'll be back with such informative content. Till then, this is Ganga Jain signing off. Thank you.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.